Well, good morning, everyone, and thank you so much for attending. I very much appreciate that. I'm excited to be here with Diab. Ali and I met some 4 years ago because I came on as an advisor to Collective Health right at the beginning, when it was you and your co-founder and I think one other person, your general counsel.
That's right.
And the past 4 years have been amazing. So why don't we get started? And you've got the introductions. You know who Ali is. And I thought we'd get started by just asking you, it's the elevator pitch. You're in an elevator. That next series of funding is on the docket. What do you tell that VC?
Collective Health is an enterprise software company that enables employers that self-insure their health benefits to do it with a level of clarity, transparency, and customer experience that you can't get from a traditional health insurance company.
All right, who's in? Exactly. So give us a little bit more color.
Sure.
Where are you guys located? How many employees? How many lives do you cover, et cetera?
We are actually in the midst of moving from San Mateo to San Francisco, right at the 4th and King Caltrain, essentially. We have 10 customers, about 50,000 lives on our platform. We have 250, 260 employees. We've raised about $150 million in capital. Our investors include Founders Fund, Google Ventures, Redpoint, NEA, Social Plus Capital Partnership, and lots of angel investors, people like Jeff Weiner, the CEO of LinkedIn, Max Levchin, one of the founders and CTO of PayPal, and others.
And Ali says it so casually. Yeah, we've started with 2, and we've got 260 and $135 million. But there's a great story behind the founding of this company, Collective Health. And so there are a lot of companies that become successful, and you just can't figure out why they even exist. And there are other companies that become successful because they really try to solve a problem. And in this case, it was a problem that you experienced personally. I think it'd be great if you gave the crowd just a sense for why it is that you decided to start this company and what was the problem you were trying to solve.
Yeah, I mean, you know the story well, but 3.5 years ago, I was hospitalized out of the blue with a life-threatening condition. I had what was basically a heart attack in my small intestine. I had most of my small intestine removed surgically in an emergency surgery. I was very fortunate that I had a general surgeon at Stanford who was world famous, world class, and saved me the long-term debilitating pain of having to have a bag outside of my body to collect my poop, for want of a better way to describe it. The unfortunate sort of consequence of the way that I was treated, though, pretty much the only unfortunate consequence, was that I ended up being in the hospital longer than I should have, and I incurred a pretty severe abdominal infection because I was kind of left open versus kind of cut open and then re-sewed together all at once for medical reasons. Unfortunately, my health insurance company didn't see it that way and decided to deny most of my hospital claims, saying that my surgery was experimental, that my longer than normal hospital stay was the result of physician malpractice. And so through the course of trying to understand why they made that determination, I developed, you could say, religion about wanting to fix just the whole experience around health insurance. And the reason why we focused on self-insured employers is we felt it was the first way to enter the market and be effective by aligning incentives between the people who are paying for care and the people who are receiving care. I think people don't know this, but after the federal government in this country, like literally just after the federal government, employers are the biggest payers of healthcare. We as individuals actually don't spend that much money on healthcare in this country.
So help us understand that concept of self-insurance is probably a little bit arcane for a number of people in this crowd, but big companies tend to self-insure for health insurance purposes.
Correct.
And small companies don't. What does it mean when a company self-insures?
So insurance, as you guys probably all know, is the pooling of risk to avoid catastrophic financial ruin in the case of something catastrophic happening. And so if you're a small group, statistically speaking, it's difficult for you to self-insure, meaning just cover your own expenses on your own, because that one catastrophic event could really wipe you out. When you're above a certain size, and typically that pool is usually a few hundred people or more, that statistical that statistical characteristic starts to become such that you can pay for your own healthcare costs without incurring a lot of risk in doing so. And that is why when employers reach a certain size in this country, the vast majority choose to not pay a third party to insure their healthcare costs, but actually pay them out of pocket and just use that third party, whether it's a United Healthcare or an Anthem or an Aetna traditionally, just to process claims and provide customer service.
So at Stanford self-insures because
Correct.
It's big enough that it feels it has a big enough population.
Correct.
Not one event will take it down.
Correct.
And it can save a tremendous amount of money, but also it can also customize its plan, right?
Yes, there's a lot of flexibility that comes with self-insurance that you don't get from buying a traditional off-the-shelf exchange type of plan. You can add things that are sort of non-traditional as a qualified medical expense, things like sort of Ayurvedic medicine, for example, trips to and from the hospital, autism care, fertility benefits, all sorts of things that traditional health insurance companies haven't sort of caught up with what the sort of leading edge or cutting edge in healthcare delivery is today, and put that as part of your plan and enjoy all the tax benefits and tax advantages of doing
But this doesn't sound like a technology company. This sounds like a business model company. But there's an element of technology that's important here that I think is what attracted so many venture firms to this.
Well, I mean, I think every technology company at some level is a business model.
Good point.
They're selling something that has a value in the market. I mean, Amazon is a great example of that. I mean, Amazon is not just a bookstore, right? It is a technology infrastructure company that sells books and other things. So similarly, we are a technology company that enables people who pay for healthcare to understand what they're paying for, optimize what they're paying for, and really sort of provide a level of benefit for the people that they're covering that you can't get in the traditional health insurance marketplace today for a lot of reasons, regulation being one of them.
So let me ask the crowd, who's gone online and tried to figure things out through your health plan and been able to actually figure it out? So when you and I first met, you said something to the effect of, we want to bring 21st century sensibilities as it relates to technology, bring the Amazon experience to your personal healthcare plan.
Correct.
Is that what you're doing?
Yes, that's exactly what we're doing. I mean,
so what does that mean?
Well, to me, it means first and foremost, like ripping the covers off the black box that is healthcare and health insurance in this country. Healthcare is the last part of our economy where you don't know what something costs until you've paid for it, which seems crazy. I mean, imagine walking into the Gap and then taking a shirt off the rack and taking some pants off the rack, and then sort of walking out the store and then receiving a bill for those pants and shirt that is like 10x what you thought it would be. No one would sort of accept that. But that is the status quo, the prevailing status quo in healthcare. So number one, for us, it means using data and using technology to really sort of blow the lid off what is driving costs in this country, because people don't understand what's driving costs in this country.
And the data part, so everyone talks about big data, and obviously there's a tremendous amount of data in healthcare. Isn't one of the elements here is that companies can actually gain access to that data, whereas if they're not doing it through you in the normal manner, they don't see those data?
Yeah, at the end of the day, the people paying for care in this country, whether it's you as an individual through your copay or coinsurance, or whether it's your employer covering the rest, should understand what they're paying for and why, and they should be able to do it in a really timely manner. Health insurance companies do provide data to employers and to individuals, but it's often very late, and it's often sort of riddled with holes where you can't sort of make sense of the complete picture. At Collective Health, we believe that we need to provide people with, obviously, HIPAA and de-identified data, because it needs to be secure and de-identified, but a comprehensive view of why things cost, why they do. Why does your maternity expense look like what it does? Why does your oncology expense look like what it does? And I think even more importantly, the industry is sort of backward looking and takes sort of snapshots of data and tells you, oh, this last year you incurred this much expense. But there's no predictive modeling that happens in the industry, and we're trying to apply some of the machine learning techniques that are used in places like ad networks, where I came from, and online retail, to help you sort of understand, okay, now that you paid this much money for this, what should you expect to pay down the road? So for example, you just paid $6,000 for an ACL repair. What other expenses should you expect to incur down the road? How much physical therapy do you need? What's the likelihood of you having to have a revisitation and having a graft or something else done to your knee? And those courses of care are actually available. The data is out there in the wild, but no one has mined them at scale and then played them back to the decision makers to understand, oh yeah, I'm not going to send that person to this hospital because their revisitation and infection rates are 2x the norm, even though this other place is more expensive for an ACL. The net present value of all of those revisits is actually much lower. And that's the calculation, for example, that my carrier didn't do when I was hospitalized.
So as you go out into the marketplace and try to get companies with employees to choose Collective Health as opposed to Blue Shield or whatever it is, or Kaiser or your competitors, why are they choosing Collective Health as opposed to the staid, tried and true legacy health insurance companies?
I think they're choosing us because of what I just said. They're choosing us for transparency and sort of the clarity around what it is they're actually spending and why.
And is it a certain kind of company? Is it an evolved company? Are they technology companies? Who are these companies that say, I get it.
It actually spans the gamut. I mean, it's not an industry-specific thing or even a size-specific thing, but I do think all the companies that we've managed to gain as customers are interested in providing benefits to their employees that their employees value, so they're actually leaning in to benefits as something that's strategic for them from an HR standpoint. But we have retail companies, we have pharmaceutical companies, we have technology companies, we have all sorts of companies that, as customers, and it's not sort of specific to one industry or another.
If you tour the collective health offices, you'll feel the culture that you guys have created. It's truly amazing. But there's also posters all over the place sharing sort of the marketing pitch. And one really resonated with me, which just, it made me chuckle, but also made me realize what you were trying to achieve here, which is sort of, it's like going up a mountain that's straight up. You said, we want you to love your health insurance plan. And then it had an ellipse and it said, yes, that was, we said love. Mm-hmm. Do you really think people can love something like that? Isn't it a necessary evil? Don't people just despise their healthcare plans?
No, the highest, so are people familiar with what a Net Promoter Score is, NPS? So recommenders versus detractors. The highest Net Promoter Score of any company in the world is an insurance company. It's USAA. They have more loyalty than Apple, Amazon, any other great brand name you might think of, Nordstrom. And so, and you know, that's, their NPS is an 81, which is very high. Ours is in the high 70s. And I think that's something to aspire to. But yeah, we think people should love their health insurance. We want people, when they pick up the phone to call their health insurance company, to feel the same kind of affection, interest, excitement, enthusiasm as when they pick up the phone to call Apple or pick up the phone to call USAA or pick up the phone to call the Four Seasons and book a vacation. Like, that should be what our aspiration is. Right now, you pick up that phone and you are like cringing with fear and uncertainty and doubt because you're like, I'm going to sit on hold for 2 hours. They're going to tell me something that I already knew, and it's just going to be a waste of my time. And that kind of return on my time investment, or ROTI, that I like to use internally, is so low, and it needs to be the other way around. Like, I need to pick up the phone, call Collective Health, and know that like within a minute or two, they're going to be helpful. This is going to be a productive call, and it would have been worth my time.
Or better yet, you could do it online and actually make it work.
Or self-serve online, yes.
Exactly. Now, you've been at it 4 years. You've pivoted a little bit, not a ton, just a little bit here and there. What hasn't worked that you thought would work, and what's worked that you didn't think would work?
Not to sound conceited, I mean, I think we did a lot of research. I mean, you know my co-founder, Roger, he's a research-oriented kind of guy, and I was a grad student for a long time and understand the value of research. We did our homework before we started the company, and I think as a result, we haven't had to pivot all that much. And I think enterprise software is probably a little bit more predictable than consumer software in that regard too, and that the path is a little clearer. I guess I would say the stuff that hasn't worked, I think there was an expectation that we could get people who were fully insured and on the smaller side of things to make the switch to self-insurance earlier in their life cycle, because the industry doesn't promote self-insurance to people for a variety of reasons, not least of which being they make less margin on self-insured accounts than they do on fully insured accounts. So we thought we could sort of convert those few hundred to multi-hundred employers to self-insurance much faster than I think we've frankly experienced. It is finally starting to happen, but it's taken a lot longer. It's taken a lot more marketing effort than I
think. Is that the biggest challenge you face today?
That's probably one of our biggest challenges. I think the other challenge that we face is just the traditional startup challenge. Like, when you're a benefits leader and you're considering buying a health insurance plan from someone, not unlike if you're a engineering operations manager and you're thinking about buying a server from someone, you don't get fired for buying Cisco, and you don't get fired for buying Anthem or United Healthcare. So that startup sort of risk that, hey, take a chance on us, we're great people, look at our team, look at our backers, even with all of that, is still hard. It's getting easier, obviously, as we become more and more well-known in the market, but that sort of inertia and that fear in decision-making is something that we've just had to overcome and will continue to overcome.
So if I were able to read the minds of the people in the crowd here, my guess is a number of you would be saying, great, you've done well. How many lives do you have now insured?
About 50,000.
About 50,000 lives. That is a flea on the tail of the elephant of the Blue Shields and the Anthems and the Kaisers of the world. Isn't this a case where as soon as they even notice you, they will stomp on you and do this themselves? Isn't that the biggest fear, that the big players will come in and say, well, that's cute. We'll just do that ourselves. It's a rounding error. You guys raised $135 million. That's nothing on our balance sheet. We'll just do this ourselves. Or are they just fundamentally, the legacy companies, unable to think this way?
There's always that fear. I mean, I'm as paranoid as any other startup founder about what the incumbents might do should they wake up to what we're doing, and they're all waking up to what we're doing. I think my experience at AdMob, quite honestly, gives me the confidence to believe that even great, nimble, technology-enabled competitors like Apple and Google have a hard time kind of moving the ship and then sort of attacking a threatening competitor that is small and even nimbler. It's the classic sort of David and Goliath type of story, I think. So I'm hopeful that that's going to be the case with collective health, but I absolutely am scared to death all the time that the United Healthcares of the world might just point their turret at us and like blow us to smithereens. I mean, it's possible.
Ali is David with a sling.
Yeah.
So you've mentioned AdMob a couple times. That was a defining experience for you.
Was.
You're a serial entrepreneur. This is an entirely different space than that was. Help us understand how that experience informed what you've done at Collective Health. What are the things that you really focused on? Culture may be one of them. I know that you've done a phenomenal job creating your corporate culture. But what was that experience? What do you take away from that? How did it inform your current life?
I mean, AdMob taught me many life lessons and many professional lessons. I think, not to generalize, I think startups at some level are all kind of the same. I mean, they're all organizations, collections of people that are ostensibly together to fulfill a purpose. And I think the things I learned at AdMob were clarity of purpose are really important, i.e. focus. Like, don't try to do everything, try to do one thing. We focused on the iPhone and building ad units for the iPhone and pretty much nothing else. And people thought that was really narrow when the iPhone came out, but it ended up being a very successful.
That kind of worked out okay for you.
Yeah, and similarly, people like, you're going to be an administrator for self-insured employers. Isn't that a really small market? It's actually not if you think about what you can kind of expand into. Just like Amazon early on focused on selling books and nothing but books, and then got into electronics and other kinds of things. So I think.
Do you see extensions for Collective Health?
Potentially, yeah, potentially. But to close on the question in terms of like the lessons of AdMob, I think for me, the biggest lesson was, I think the best ideas are one that spur economies. And what I mean by that is, at AdMob, we enabled publishers to make money who were new to mobile and trying to develop apps for the mobile web and for the iPhone. And similarly, we allowed advertisers to acquire customers in a cost-effective way. I think Collective Health is no different. Our platform enables employers to understand where to deploy their spend and provides a mechanism for people who are trying to innovate in the delivery of healthcare to get in front of those employers in a way that's much more immediate, much more transparent, and hopefully create a true economy, a marketplace, if you will, where the buyers and sellers of healthcare have a much closer, much less mediated or intermediated relationship than they have now, where a big juggernaut sits in the middle and basically directs the money the way that they want to, versus having more of a marketplace to buy and sell services.
All right, so 5 years from now, September of, 21.
Yeah.
What does Collective Health look like?
Hopefully just a bigger version of itself. I mean, I think
instead of 50,000 lives, it's 500,000 lives, 5 million lives?
Hopefully millions of lives.
Millions of lives all over the country.
Hopefully all over the country, maybe even internationally by that point. I think we'll just be a bigger version of ourselves organizationally, hopefully a more profitable and efficient and well-functioning one, but I think just a bigger version of who we are, bigger, more mature version of who we are.
Fantastic. We have 4 minutes and 36 seconds left. They were very definitive about stopping on time. And if there are any questions, we'll have a mic come over, and we'd love to have questions for Ali. If you can make those questions really pithy and concise, I know Ali will do the same in answering those questions. Any questions from the crowd? We have one right here.
You said you were going to be international. A lot of the world has national health services. Does this look different if you're administering a small country rather than a large company?
Actually, it doesn't. So I'll answer the question in two ways. We actually have a national health service in this country, too. We have Medicare and Medicaid, right, covers 45% of the healthcare spend in this country. So to say that the U.S. doesn't have a national health service is not fair. But I think even in other countries, employers in particular tend to buy supplemental health insurance because the national health services tend to be heavily overutilized. And so for certain kinds of procedures, they end up buying supplemental insurance that then is serviced by private sector providers, private hospitals, private practitioners, things like that. And so there are markets like Europe where that's the case, but also parts of Asia and parts of Latin America where there is a large supplemental insurance market for employer-sponsored care that we think we can participate in. The second part of the answer is I actually think if you extrapolate, a federal health service or even a state health service looks like a self-funded employer. You have revenue in the form of tax receipts, and then you're actually paying out of pocket, and you're not paying a third party to self-insure. So we have already sort of begun discussions with a lot of the large Medicare, Medicaid-like and other federal programs to be the sort of plumbing, if you will, the platform to allow them to administer their health benefits for the population. It looks like a self-funded population at that level.
Other questions? I think there's one right here in the front row.
How have you kind of changed the experience when somebody gets a statement and they don't understand it? You know, you said it takes 2 hours, and being a person that has called and been very frustrated at the end, how do you turn that into that 5-minute conversation you were saying that makes it meaningful?
Well, hopefully you spend enough time on designing that statement, or whatever you want to call it. We don't call it an EOB, but whatever it is, that it's pretty self-evident what's covered and what's not. I think part of the problem in the industry is that there's just a dearth of design resources applied to actually making the experience intuitive for people. And so when people receive a statement, whether it's electronic or in the mail, should they choose to opt in to it, I mean, we've done tons of research around the vast majority, I think actually 100% are very sort of confident understanding what's been covered and what's not. But I think the other thing is just the attitude towards customer service. I mean, our call center is actually in our headquarters. It's staffed with all 4-year university graduates, people like Stanford University graduate, Harvard graduates, Tufts University graduates, Berkeley graduates, people often who have MPHs or even stopped out of medical school because they want to work in industry. And we answer the phone within 2 rings. I mean, it's like the Southwest model of customer care. And for us, we view the call center not as a call center or a cost center, because that's how most people think about it, but really as our primary user interface with customers. So the tools that are also available to the people answering the phones are they're exactly the same ones that you would use if you logged in and self-served. So they see exactly what you see, and they can read and explain to you exactly what you've seen. It was frustrating to me calling my insurance carrier when I was sick and being told, oh yeah, you need to get your plan document from your employer. I don't know what's in your plan. I don't know what's covered. It's like, you're my health insurance company. It's sort of like calling AT&T and being like, what plan am I on? And they're like, oh, get your bill, call me back and tell me what plan you're on. It doesn't make any sense. And so just that kind of attitude that like, I'm actually trying to lean in and service you and serve your needs versus treat you like somebody who's a nuisance that I want to go away, it just changes the entire orientation of the organization.
We have time for one more question. We have 1 minute left. Questions? There we go.
Hi there. I'm wondering how you are getting the word out to small business owners about your service, because they get a lot of mail, they have their preconceived notions about how to serve their employees, and it's not an easy market to crack. So I was just wondering what your approach has been.
Yeah, we use a multi-channel approach. So we do everything from buying online ads and sponsoring online content for on benefit sites and other types of sites that HR resource managers, human resource managers spend time on, to going to conferences, to working with channel partners like health benefit consulting firms. It's a mishmash of things, and we experiment. I think that's the one thing I learned at AdMob. In terms of customer acquisition, you have to be experimenting all the time, and we try all sorts of different channels and see what works and deploy more money there, and then pull back from areas that don't. We also buy big billboards on 101 just to kind of raise awareness. So we do everything.
Allie, thank you so much for taking the time.
Thank you.
Very much appreciate it. Thank you for coming.
All right. Thank you.